Volleyball is a team sport played between two teams, each consisting of 6 players. The objective is to score points by grounding the ball on the opposing team's side of the court. The game involves a combination of strategic plays, precise ball control, and teamwork. But today we are going to be presenting on the most essential part of the game, which is the volleyball serve. It is the action of initiating play at the beginning of a rally. It involves a player setting the ball over the net to the opponent's side of the court with the intention of starting the game or scoring a point. There are various types of volleyball serves, such as underhand, overhead, spin, floaters, but today we're going to talk about the most effective type of volleyball serve, which is the volleyball jump serve. So just like that clip, the jump serve adds a level of unpredictability as it maximizes the effectiveness by combining power, accuracy, and strategic placement. The terms of success for this motion involves the player mastering accurate placement, the ability to repeat completion, and having a strategy to hinder the opposing team's defense. There are 5 phases to a jump serve. The first phase, which is the approach, consists of optimal placement for the toss of the ball and the first step. The second phase, which is the takeoff, allows the player to gain momentum with their run and propels themselves forward with an explosive jump. Next is the arm cocking phase, when the player draws their arm back like one would pulling a bowstring and creates a forceful impact with the ball. Next involves the acceleration of the arm, which creates optimal power with the ball. And lastly, the player concludes the skill with a follow-through, which ensures the continuity of the motion and maximizes the utilization of the generated momentum. Overall, the jump serve is simultaneous and sequential in nature, depending on the phase.
We conclude that a volleyball jump serve primarily serves as a giving motion classification and now movement for fitness and exercise. Since we are mainly focusing on the kinesiological analysis, also in this situation, we are viewing this topic as if you are in a competitive circumstance. This can be confusing between the two categories because a player does give motion to a volleyball after impact with the player's hand, while volleyball is a recreational sport for fitness and exercise. Overall, we are here to provide information to optimize your jump serve to its full potential. In this slide, I'll go and describe some specific skills, techniques to improve your performance. During a jump serve, we would want to be in a stable position both before we jump and when we land. In terms of stability, it's crucial to maintain a large base and a low center of gravity. Stability is important because it helps prevent us from falling during the short sprint to the ball after the toss. Producing maximum force is also crucial in this situation. To generate optimal force, it is important to utilize most of our joints. The more joints involved in the movement, the greater the force produced. Using many joints in this movement is desirable because it engages more muscles, therefore more contraction. Some of the joints that should be involved include our knees, hips, ankles, as well as the joints in our hands and feet. Since I mentioned joints, a principle that plays a crucial role in this movement is the kinetic chain. To produce maximum velocity, you need to use the joints in order from the largest to smallest. For instance, during our jump, the sequence should be the vertebrae, hips, knees, ankles, and the phalangeal joints of the feet. In the spiking phase, it would be from the vertebrae, shoulders, elbows, wrists, to the phalangeal joints of the hand. Depending on the phase of the movement, these joints will enable us to jump higher and strike the ball with greater power. In order to create high velocity ball movement, it all starts with impulse. Impulse is defined as the application of force over a certain time period, which results in a change in momentum. This is calculated as force multiplied by time, leading to a change in momentum. Momentum, in turn, is a measurement of how much motion a mass has. It is calculated by multiplying mass and velocity. In essence, the more force created over time, the larger the impulse. And the larger the impulse, the more momentum is generated. With a substantial momentum, we can propel the ball with great velocity. As we start to run just before the jump, we generate force over time, resulting in an increase in momentum. This momentum is then transferred to the jump itself. During the jump, when we make contact with the ball attains high velocity because of the remarkable momentum from the jump is transferred to the point of contact with the ball. Let's now stray away from the technical part and look at the bigger picture. There are many other ways to improve our jump serve. Let's start from the beginning of a jump serve. When tossing the ball in the air, it's essential to keep our arms straight. Once we master that, we need to practice the toss itself. The goal is to make the ball go straight up and in front of you. We do not want it to go to the right or left. A helpful practice technique is to place a volleyball bin a meter away and toss the ball into it. Regarding our approach to the floating ball, the ideal number of steps before jumping is typically 3 steps. However, you can always adjust the number of steps to your liking and what works best for you. While running to the ball, it's crucial to swing your arms closely to our body, moving them back as far as we can before swinging them forward to generate more momentum. We do not want to extend our arms as if we're flying. As we swing our arms back, take a long step right before jumping. Throughout this movement, keep your eye on the ball. This skill is crucial because losing sight of the ball can result in suboptimal contact or no contact at all. Keeping an eye on the ball also helps us time our run, jump, and contact with the ball. Lastly, when making contact with the ball, make sure your wrist is slightly loose and not stiff. From the couple of previous slides, you have an idea of what the common mistakes are when performing a jump serve. The common mistakes during a jump serve include tossing the ball with a bent elbow, tossing the ball too far to the sides, tossing the ball too high, jumping too early, spreading our arms outwards and away from the body, taking a short last step, not looking at the ball, and having a rigid wrist. There is one technology that may improve our jump serve. This technology is the Pocket Radar. What this machine does is provide instant feedback, helps you find an ideal ball speed and accuracy. Incorporating the Pocket Radar into the program, it will allow players to have a more consistent and strong serve, and an idea of what a jump serve should feel and look like. With this technology, it sets high standards for players. In the next couple slides, I'll go ahead and provide some information regarding training and conditioning. In order for us to perform the jump serve optimally, we must establish a solid foundation. This foundation can be built in the weight room, and there are specific workouts we can do to enhance mobility and power. The first one is Good Morning, which improves vertical strength. The next exercise is the side-to-side twist with overhead press, beneficial for shoulder health and aids in transferring power from the core to the upper body. Another recommended exercise is the single leg RDL to overhead press, enhancing balance and jump performance. To address the times when we have to jump with one leg, include the lunge with a twist exercise in the routine. For power and explosiveness improvement, dumbbell snatch is one of the most effective exercises. Since the jump serve involves an arm going overhead, 2 exercises that can assist with this are dumbbell pullover and dumbbell squat to press. All of these are excellent training exercises and should be integrated into the training program. Some conditioning drills include toss and catch, jump and catch, approach, jump and catch, serve to targets, and game-like drills. The name of these conditioning drills are self-explanatory.
Joints involved and their movements. In the upper extremity, we will be focusing on the shoulder, elbow, and wrist joints. Meanwhile, in the lower extremity, we will be focusing on the hip, knee, and ankle joints. To successfully perform a volleyball jump serve, a vertical jump must be incorporated. In a vertical jump, there is a preparatory phase, takeoff phase, and landing phase. Starting with the preparatory phase, flexion of the hip, knee, and ankle dorsiflexion must occur. Also, an eccentric contraction occurs in the hip joint, allowing the pelvis to move anteriorly. In this particular joint, the muscles that partake in this action would be the rectus femoris, iliopsoas, sartorius, pectineus, and tensor fascia lata. In the preparatory phase, flexion of the knee joint takes place, allowing the thighs to move in an eccentric contraction. Therefore, with the help of the hamstrings, gracilis, sartorius, gastrocnemius, plantaris, and popliteus, knee joint flexion can occur. The ankle joint is the last joint that is involved in the preparatory phase of a vertical jump. In this joint, dorsiflexion of the ankle can occur, which allows for the movement of the lower leg in an eccentric manner. The muscles that assist with this movement are the tibialis anterior, extensor digitorum longus, extensor hallucis longus, and peroneus tertius. The next portion of the vertical jump is the takeoff phase, which allows for the extension of the hip, knee, and ankle plantar flexion. The muscles that allow for hip extension are the semitendinosus, semimembranosus, biceps femoris, adductor magnus, and gluteus maximus. At the hip joint, the pelvis will shift posteriorly concentric. Moving on to the knee joint, the muscles that allow for extension are the rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. At this point, the thighs are moving concentrically. Finally, the muscles that allow for ankle joint plantar flexion are the gastrocnemius and soleus, which permit the lower leg to move concentrically. Once an individual has completed the jumping aspect of the volleyball jump serve, they are ready to use their upper body muscles and joints to perform the hitting portion of the serve. The upper extremity requires using the shoulder, elbow, and wrist joints. Internal-external rotation, shoulder abduction, adduction, and horizontal shoulder abduction, adduction can occur in the shoulder joint. Starting off with internal rotation. The muscles involved in this action would be the subscapularis, pectoralis major, latissimus dorsi, teres major, and anterior deltoid. Meanwhile, the muscles that perform external rotation are the infraspinatus, teres minor, and posterior deltoid muscles. In shoulder abduction, the supraspinatus and deltoid muscles are involved, while in shoulder adduction, the body requires the use of the latissimus dorsi, teres major, and pectoralis major. Lastly, the volleyball jump serve allows for horizontal shoulder abduction, and the muscles used are posterior deltoid, infraspinatus, teres minor, and the long head of the triceps. In contrast, horizontal adduction in the transverse plane involves the pectoralis major, anterior deltoid, and the coracobrachialis muscles. The osteokinematics in the elbow joint are flexion and extension. The biceps brachii, brachioradialis, and brachialis are activated in elbow flexion. However, in extension, the triceps and anconeus allow for that movement. Lastly, the osteokinematics in the wrist joint during the volleyball jump serve allows for flexion and extension. For wrist flexion to occur, the muscles that must be involved are the flexor carpi radialis, flexor carpi ulnaris, and digitorum superficialis. On the other hand, for wrist extension to occur, the extensor carpi radialis longus, extensor carpi ulnaris, and extensor digitorum must be active. Therefore, all joints must be used to their full potential to produce power in a volleyball jump serve. With the involvement of all joints, this allows for the contribution of more muscles, eventually creating more force to execute the serve faster and more powerfully. Some neuromuscular mechanisms that can help when performing a volleyball jump serve are proprioceptors, fast-twitch muscle fibers, and visual motor skills. Proprioceptors are one of the most important mechanisms involved in a jump serve, as they help athletes know their current body position without actually seeing it. Proprioception also improves athletes' balance, agility, and lower limb explosive strength. On the other hand, fast twitch muscle fibers assist with performing a jump serve, as they allow for rapid force production during explosive movements. Therefore, training this particular muscle fiber type can enhance an athlete's speed and force. Visual motor skills are the last neuromuscular mechanisms that can assist when performing a jump serve. In visual motor skill, depth perception is critical for an athlete, as it allows them to correctly perceive where the ball is and how far they intend for it to go. Visual recognition also enhances an athlete's ability to perform the skill successfully. Through this, a player recognizes and can perform strategies based on their previous experiences on the court. Neuromuscular mechanisms that can hinder an athlete's ability are limited range of motion, muscle fatigue, and slow twitch fibers. If an athlete were to have limited range of motion, the jump serve would not be as effective. This is because in order to perform a jump serve correctly, the involvement of your shoulder, elbow, wrist, hip, knee, and ankle joints are required to distribute the force throughout the body properly and hit the ball. Thus, with limited mobility, the serve will be less powerful and rapid compared to an athlete with a wide range of motion. Muscle fatigue can also affect an athlete's neuromuscular function. Fatigue can lead to decreased coordination, reaction time, and overall performance. So, if players experience fatigue too quickly, it can affect the quality and consistency of their jump serves. Lastly, slow twitch muscle fibers can hinder an athlete's performance. Although they are equally crucial to fast twitch fibers, they are ineffective when performing a jump serve. Therefore, if a player were to have more slow twitch fibers, their performance and agility when jumping and hitting the ball would decrease. Some anatomical principles that contribute to the maximal efficiency of a volleyball jump serve are increasing your lower body strength, core stability, shoulder mobility, and timing and coordination. Strengthening lower body muscles allow an athlete to rapidly extend their hips and knees in order to effectively perform that jump. Additionally, stronger lower body muscles allow the individual's body to be prepared in receiving that impact once they hit the ground. The next anatomical principle that is important is core stability. A strong and stable core is essential for maintaining proper body alignment during the jump serve, allowing force transfer from the lower body to the upper body. This enables for a more coordinated and powerful motion. With the upper extremities, an athlete must have shoulder mobility and strength to execute the motor skill serving portion. Strengthening the shoulder muscles contributes to the power and accuracy of the serve, allowing the ball to reach the opposing team's side rapidly, preventing any chances of them retaliating. Lastly, timing and coordination of movements are crucial for an effective jump serve. With this complex movement, an athlete must approach, jump, and swing their arm in a precise manner in order for them to hit the ball on time and for it to reach the other side of the court. Some principles that are directly related to avoiding injury are proper warm-ups, pre-season conditioning, stability, proper technique, range of motion, and cool down. Proper stretching allows the body to receive more blood flow to the muscles, increases flexibility, and prepares the neuromuscular system, reducing the chances of strains or tears. Meanwhile, being physically active before the sports season begins can prevent any injury, as the athlete can strengthen their shoulder, back, gluteals, and leg muscles. Also, with solid and balanced muscles, the body will have more joint stability, reducing the risk of strains on the ligaments and allowing the athlete to produce more force when serving. Core stability is another crucial aspect when performing a jump serve, as it protects your spine and maintains proper body alignment. A stable core allows force transfer from the prime mover to the distal segment, which in turn lowers the body's ability to find compensation. If the athlete does not have a stable core, the body could compensate by overusing the other muscles, increasing their risk of injuries. The next principle is proper technique. Proper technique allows the body to have an even distribution of forces, preventing the overuse of muscles and the chance of harm. Additionally, having a wide range of motion allows the joints to perform to their full extent, which in turn causes the muscles to move appropriately. Lastly, a cool down, such as stretching after a workout, can help the body return to its normal state and prevent any dizziness or fainting. A cooldown allows the person's body to naturally bring down their heart rate and blood pressure. Stretching also serves to allow the muscles to relax, reducing the soreness and aching muscles one usually feels after a workout.
Segmental interaction brings attention to the proper engagement between the legs, trunks, and arms, which is a fundamental requirement for a powerful and coordinated jump serve. Each segment's contribution is vital for force production and energy transfer. Coaches emphasize drills focusing on the sequential activation of body segments, enhancing the integration and synergy between the legs, trunks, and arms during the jump serve. Here, the notion of the jump serve as a whole body engagement becomes noticeable. Improper segmental interaction will lead to a poor use of force built from the previous principles. Finally, achieving optimal projection combines these principles together. It involves a delicate combination of force production, coordination, and timing. The ability to project both the body and the ball in the desired direction is needed to perform the serve with maximal efficiency. Players should meticulously refine their jump serve technique, ensuring the coordinated application of force, precise timing, and a well-controlled follow-through. The culmination of these elements leads to optimal projection of the serve over the net. Only through all these principles will the jump serve be most effective and accurate. Enter the Magnus effect, a biomechanical phenomenon that adds a strategic dimension to the serve. Applying topspin to the ball creates a fascinating interplay between airflow and pressure. The ball, spinning opposite to the airflow at the top, experiences greater pressure, resulting in increased speed and a subsequent downward force. Executing a successful topspin relies on the precise downward snap of the wrist during contact, harnessing the force built from the earlier phases of the serve. Each biomechanical advantage seamlessly contributes to the next, forming a holistic approach to the volleyball jump serve, from the precision of the ball toss to the strategic use of the limb length, overcoming inertia, optimizing body mass, and culminating in the Magnus effect. These biomechanical intricacies are the keys to a successful, powerful, and unpredictable jump serve.
In a volleyball jump serve, the individual must perform repetitive jumping and overhead motions to serve the ball to the opposing team. But over time and with constant use, a player may suffer from various types of injuries. One of the most common injuries is rotator cuff tendinopathy, which is when a tendon in your shoulder has tiny tears in it or is inflamed, causing sharp shoulder pain. Moving on to biceps tendinitis. Biceps tendinitis is caused by micro tears in the tendon and is a similar type of injury that can occur due to repetitive motion, overuse, or severe load to the tendon. The next type of injury consists of two types of glenoid labrum tears, the first one being the superior labrum from anterior to posterior tear, and the second one being the Bankart tear. If a player were to have a slap tear, it would appear in the labrum as it connects to the biceps tendon. Bankart tears, on the other hand, occur due to a dislocation of the shoulder joint, which causes the labrum to tear and pop out of its socket. Bankart lesions can also cause instability, leading to frequent shoulder dislocations. Some common symptoms of a torn glenoid labrum are dull and aching pain in the shoulder, causing difficulty in performing regular shoulder movements. The next type of injury a volleyball player can suffer from is shoulder impingement syndrome, otherwise known as SIS. SIS occurs when a person's shoulder is compressed against another part, causing them pain. Athletes with SIS usually complain of pain when following through or finishing a serve. The next common injury in a volleyball jump serve is lower back pain or strains due to repetitive bending and rotating of the trunk. Repetitive hyperextension can place stress on the lower back bones, leading to vertebra fractures, also known as spondylosis. In the lower extremities, ankle sprains are one of the most common injuries seen in volleyball athletes. It can be caused when a player lands on the outside portion of their foot, causing a sprain on the lateral ankle ligaments. Very few ligaments support the lateral portion of the foot compared to the medial portion, so sprains are very common and can be easily found in that area. The next common injury is patellar tendinitis. Patellar tendinitis is inflammation of the tendon that connects the kneecap to the tibia. With repetitive forceful jumping activities, tiny tears in the tendon can appear and multiply, causing pain from the inflammation and eventually weakening the individual's tendon. The last common injury is anterior cruciate ligament tear, otherwise known as ACL tears. ACL tears is one of the many common but severe injuries a player can go through both physically and mentally. This is because the recovery time is usually at least 6 to 9 months, and patients who return to their pre-injury level of sport do not perform well as before the ACL injury. This is because they report fear of re-injury or lack of self-confidence. Therefore, one of the most common ways an athlete can tear their ACL is if they were to jump and land awkwardly, overextend their knee joint, or even quickly change direction after performing their serve. The ligament may tear or stretch partially or even completely. This concludes our presentation. Thank you.